Staffing levels continues to be a concern in hospitals in the province. An Orangeville Hospital is reportedly using kitchen staff to assist nurses. A nurses association says the province needs to step in before the situation worsens.
Their day-to-day workflow is exhausting. Many nurses are still working 14, 16 hours.
The Chief Executive Officer of the Registered Nurses Association of Ontario, Doris Grinspoon, says although the Ontario nurse staffing crisis was bad pre-pandemic, it has gotten much worse in the past 2 years. She says nurses are calling in sick not only because they're getting the virus, but for a number of reasons.
If people call in sick, if people need to be absent because their child is with high fever because of Omicron, or their parent or their spouse. I mean, nurses are people also.
Headlands Healthcare Center in Orangeville says as of yesterday, nearly 5% of their 925 staff, physicians and midwives are off sick or are at home self-isolating due to COVID-19. In order to deal with the staffing crunch, staff members from other departments are doing things like portering patients or helping feed patients.
Registered practical nurses are calling us and saying, I don't know what to do with these people when they come. I mean, yes, everybody appreciates help, but it's got to be the right help. And, what are they to do? They can't do any kind of nursing work because they are not skilled to do so, and that would make it more dangerous. Do they answer call bells? Well, most of the time, if a patient is ringing their bell, it's because they need assistance.
The Orangeville Hospital tells CityNews at no time have non-regulated employees been redeployed to provide any nursing care. The situation continues to be worrisome at other hospitals as well. A spokesperson from Niagara Health tells CityNews their Fort Erie Urgent Care Centre has been closed since January 6th due to staffing shortages. No word on when it will reopen. Grand River Hospital in Kitchener says while they are experiencing large wait times in their emergency department due to a lack of bed capacity, on a few occasions this past week, they saw a greater number of staff returning following illnesses or exposure. They add it's too early to call it a trend, and they anticipate staffing shortages to continue. However, Grinspoon points out many nurses are leaving the profession due to Bill 124, which generally limits annual salary increases to 1%. She says Premier Ford made a big mistake.
You should have repealed that bill or exempted nursing out of that bill right from the get-go of the pandemic, and we are still fighting for it because nurses see it as a flag of disrespect, and many are leaving the profession or Ontario because of the bill.
Grinspoon adds the nursing crisis needs to be dealt with right away as nurses are necessary to make hospitals run, whether it's in assisting Omicron patients or helping with procedures and surgeries which have currently been delayed.